Sorry, just checking. Great. So welcome to this training session, Suicide Safer Placements, Supporting the Mental Health of Students on Placements. My name is Sue Deval and I'm a consultant social worker with the West Midlands Social Work Teaching Partnership. And for people who may not be familiar with the partnership, we are here really with the aim of strengthening the quality of education and training for social workers, social work students and practitioners across the region. We have our there's a message that people can't hear. Can anyone else? Has anyone else got a problem with sound? You can hear.
I can hear.
Thank you.
I can hear.
So that's Nicola. I don't know whether you can adjust something on your okay, so as I said, the teaching partnership is just here to promote training and education for students and practitioners. As part of that, we offer a series of CPD sessions, of which this is one of them. And as members of partner organisations, the CPD is free for practitioners to attend of our 27 partners across HEIs, local authorities and trusts. So this morning we've got Tom Henri here, who's an assistant professor at the University of Birmingham, and he's the lead for practice learning across the BA and MA courses, amongst other things. And he is a champion of supporting student mental health and wellbeing, and facilitated a workshop for us at our Practice Educator Conference in June last year, which was very well received. It was very interesting, and I think had some really key learning, which we were keen to share more widely across the partnership. So with that in mind, Tom very kindly agreed to do a sort of further repeat session of the workshop that he'd done, and that's why he's joining us this morning. So we're very appreciative of his time, and I will hand over to Tom to take you through the rest of the training. I've actually got to leave to go to another meeting at 11 o'clock, so I will dip out possibly before the end, but my colleague Kate is also on the call if there are any issues that people want to follow up. Thank you very much, and I'll pass over to Tom.
Thank you, Sue. Thank you for that introduction, and thank you everyone for being here. I think there's 30 people here this morning, which is a fantastic turnout, and I think this says a lot, doesn't it, about how we are thinking about student wellbeing and student welfare during their practice learning experience in a way that perhaps we didn't in the past. And I'm certainly reflecting on my own practice learning experiences of, well, as someone pointed out to me the other day, most of my students weren't born when I graduated, which is scary thought. But you know, thinking back to my own practice learning experiences, and it's kind of left to it really. The idea that you might have kind of well-being issues or those kind of things where placement was never really talked about back in those days. You know, you just kind of left to get on with it. And I think so. It speaks volumes that there's so many people here this morning that I think we've moved a long way in certainly the last 20 years around how we think about student wellbeing on placement, but there's clearly more to do. And certainly I think this morning we'll perhaps look into where we can go from here. So this presentation will take about 40 minutes, and then we've got however long we need for some discussion after that. I'm assuming here that everyone has some interest in practice learning and practice education. Perhaps if people perhaps put in the chat what they're, whether they're just say what should we ask? Are you a practice educator, and or what is your interest in practice learning? If you could put something like that in the chat, so I've got a sense of where people are at in the room just while I'm doing my introductions, that would be really useful for me. So, oh yeah, brilliant. Okay, thanks people. It's all coming through now in the chat. I can see, brilliant, good stuff. Okay, so so this morning I'm going to be talking mainly about a document called Suicide Safer Placements that was issued by an organisation called Universities UK on last 2022. So it's quite a recent So just watching the chat while I'm talking at the same time. So this is quite a recent update, really. So I'm going to talk about this document, this policy guidance document from universities UK, and I'm going to talk about some recommendations from that. I'm going to talk about what we're doing at University of Birmingham in order to implement many of the recommendations from this guidance, and then we'll have some time at the end to think about, provide an opportunity to think about how you can further develop your practice around student wellbeing. I think simply by the fact that you're in the room means that you're probably doing something positive. You know, if those who are practice educators or the supervisors are probably doing positive things around student wellbeing anyway. Because obviously the more we can do and how we can foreground student wellbeing in the placement learning experience is something that we can continue to reflect on. So a little bit about me. Well, it's looking a bit grainy from my end. Is that anyway? So that's my dog Bruce. I'm Tom Henri. I'm the practice learning coordinator at the University of Birmingham. I keep saying I'm new here. I've actually been at the University of Birmingham for a little over a year now. And my role here is essentially sorting out the placement learning opportunities for the BA and the MA students, essentially, and doing placements. However, I've been a social work academic for over 20 years. I think I took my first visiting lecture in 2006, I'm going to say. Is that 20 years? No, it isn't, is it? Anyway, maths is not my strong point. So, but I've been in the academic game for, sorry, I qualified 20 years ago. I qualified 2001, but I've been doing academic stuff since 2006 part-time, and then 2008 kind of full-time, mainly at Goldsmiths University, but also Leeds, Huddersfield, Open University, and University of Birmingham. So in that time, I've probably assessed and supported hundreds, if not thousands, of students on placement. And I think the thing that's always impresses me when I'm working with students on placement is about the multiple pressures that students experience and how they deal with them. So when I was doing my social work qualification, I was youngish. I was single, no responsibilities in terms of children, got a full grant, didn't have to pay student fees, and I'd actually quite a well-paid part-time job as well that supported me through my learning. So, you know, for me, I had a relatively easy path through practice learning. I had two really great placements, two really brilliant practice educators, and I found it stressful. You know, it was a stressful experience being on placement. It was hard work. You know, you expected to work effectively a 37-hour week, or effectively never pay, whilst doing all the learning and, you know, and all the other stuff on top of that. And I look at some of my students, I look at some of the students I've supported over the last decade or so, and look at what's going on in their lives in terms of their own personal lives, their caring responsibilities, their personal situations, how they're able to cope with the academic work and all this sort of thing. I think, my gosh, some students, the odds are really stacked against them. And the way that students come through that, I think, is always super impressive. But that doesn't mean we can kind of rest on our laurels and go, okay, well, students will kind of become resilient. And I'm not going to go into too much about resilience this morning, because there's obviously issues around resilience discourses. So, but the point is that, you know, being on placement is hard. And we have to remember that. And some of us that haven't been on placement for a long time, is worth remembering. I suppose the obvious one to think of there is, if, you know, when you talk about students about direct observations, and, you know, oh my gosh, yeah, 20 years since I did, over 20 years since I was directly observed in my practice in that way. But, you know, still now, even 20 years later, a direct observation, my heart kind of starts to race a bit. And everyone has that kind of fairly similar response, I think, to thinking about direct observation. So, you know, we can all empathise with how students must be feeling in placement, because, hey, we've been there. So anyway, that's a bit about me, and let's talk about the guidance. So the guidance came out last year, but it's on the back of another piece of guidance that came out in 2018. So the guidance came out in 2018 was called Suicide Safe Universities. And so this was a piece of guidance published by Universities UK, which is an umbrella body for universities. So it's basically the Vice Chancellor's kind of organisation. They all get together and plan what it is they're going to do as university leaders. So they published this document in 2018 with PIRUS, which is National Charity on Suicide Prevention. And it was aimed at university leaders. And it was really about what to do about suicide, self-harm, risk of self-harm, and so on campus. So, what steps could universities put in place to prevent student suicide? What interventions can universities put in place when students get into difficulty? What's the best practice to responding when there's been a tragedy? And it involved various numbers of various case studies on approaches to student prevention, and a checklist for university leaders to steps they could take in order to make their university communities safer. So that's the 2018 guidance, suicide safe universities. And then last year, 2022, there was an addendum published called suicide to the guidance called Suicide Safer Placements. And this was published in response to a campaign by the family of Harrison and George, who tragically died whilst on a teaching placement. So he was doing initial teacher education at a university in London, I believe. I'm not sure which one off the top of my head. And he tragically took his life whilst on a teaching placement. And so the guidance, suicide safer placements, includes case studies on good practice across a number of settings around where students will go on placement while in university. So teaching, obviously, health and social care, including social work and industry placements. So I'll put it in the chat now too. I've put in the chat the link to the guidance. If you click on that link, that should take you straight through to the guidance. If you wish to have a look at it, you're of course more than welcome to. So okay, so that's the background to the guidance. Now let's get into the background of what we mean in terms of why we need to think about this and why placement students need support. So we know that practice learning is an essential element of social work training and education, and we have to do, everyone has to do 170 days on placement as stipulated by Social Work England. Now, placements involve a significant amount of change for students, new settings, new challenges, new colleagues, additional cost. It's, there's a lot going on going into the practice learning environment. And we know, because we're social workers, we know this, don't we? That when people have experienced good mental health and well-being, they're better prepared to deal with change, they're better prepared to deal with new situations, they're better prepared to learn and thrive. We know that because we're social workers. That's what we do, isn't it? As social workers is work around these kind of issues. So this shouldn't be really any surprise to us at all. So you've got, we know that good mental health, good well-being is beneficial across all aspects of life and learning. And there are inherent risks involved in being on placement, about that transition from university-based campus learning to the practice learning experience can negatively affect students' well-being and mental health. And so, we have to acknowledge that. Okay, this is that transition from the campus to the placement learning experience is potentially a challenging time, potentially with negative consequences for well-being and mental health. So that's the first point. That's the first learning point. Really, is to acknowledge that and say, yes, this is part of we think about people's equilibrium and that sort of thing. We know this stuff, don't we? It's when we start to think about it. So there is an inherent risk involved in transition to the placement learning experience, and this often includes the access to support. And I'll come back to that point in a bit, because that's something that I really want to reiterate this morning, is about how we encourage and support, how we encourage support students in order to access the support that's available for them. So I will come back to that point. So there's a couple of bits of research that went into the production of this report that didn't necessarily look at suicide per se, but at student mental health as a proxy for risk of harm. So the first one is the Student Mind Survey of 2020, September 2021. So Student Mind Survey is an annual survey of representative cross sample of students, not just social work students, it's undergraduate students from across the UK. So if we look at the 2021 survey, it will be no surprise at all that although most COVID restrictions had been lifted by September 21, that the pandemic was the #1 negative impact on students' mental health. I don't suppose it's going to be any surprise to anyone, really, is it? That's where we were at in September 21. So that, and I think I might come back to this point. I think there's a long tail to the pandemic that I think we need to be aware of. This was obviously a survey of undergraduate students in 2021 who had obviously spent a significant part of their undergraduate studies during COVID lockdowns. Now, that 2021 generation have probably graduated now. They're probably ASYEs in your local authorities at this point. But what we have got is actually, they won't quite. Oh yeah, it will be just. But what we have got then is a generation of younger people who spent their formative years in their bedrooms. Now, I'm not going to go into too much detail into what I was doing when I was in my middle to late teens, but I wasn't sat in my bedroom on TikTok. You know what I mean? So, in terms of the kind of socialization experience of a whole generation of young people, I think we really have to think that there's a long tail on their experience and their formative years. And how that's going to impact on their university experience, their practice learning experience, and their experience as employees and workers in the sector. So although it's kind of easy to think of the pandemic as being a historical artifact now, I think it's still current. I think it's still with us. I think it will still continue to be with us to years to come. But going back to the September 2021 survey, 63% of students reported the pandemic was continuing to have a negative impact on their mental health. So that's 2/3 effectively, isn't it? So it's it's huge. It's having a huge negative impact on well-being. And according to the survey, 2/3 of students with a mental health issue have not disclosed it to university. So we have students who have disclosed mental health issues, and we encourage them to when they go on placement to be open and honest about their mental health and how that impacts on their ability to learn and to practice and so on. But if we take this as given, then for every student we know that's disclosed a mental health issue, then we've got 2 that haven't. So we need to think about that as well, don't we? In fact, just because a student hasn't disclosed a mental health issue doesn't mean that they have some sort of mental health issue. But the overriding thing that came out of this survey was the pandemic continued to shape students' experiences. And that's certainly the student cohort that graduated this summer and from UOB, certainly talking to them, the pandemic shaped their university experience. So moving forward in best part of a year, so next year, the following year, student mind surveys is July 2022. Now, so this is what actually September 21, so 9 months later. And of course, the big thing that's affecting students' wellbeing and welfare at this point in time, not the pandemic, not studying, not loneliness, cost of living crisis. Yeah, by this point in time, we're in a situation where rising costs of everything is having a negative impact on all of us. No, this is not we've all been struggling in the last year or so around cost of living crisis. I'm not going to go into political reasons to political solutions, what you do about that right now. But let's just say that this is having a huge impact and continues to have a huge impact on all of us. And then if we take into account the multiplicity of issues that students are experiencing around studying, around the long tail of COVID that we talked about, around the pressures that we talked about, the transition from campus to placement learning, it's just stacking up, isn't it? The issues are stacking up on these students. So Cost of living crisis is having another issue. 1 in 3 students said that being at university itself would have negative impacts on their mental health, which is from someone who works in the university is a terrifying statistic, and also not that surprising. How about this? Over half the student survey, this is essentially a random but sample of students. Over half the student survey said they're currently experiencing a mental health issue. That's huge, isn't it? And if we translate that across to the students that we work with, but let's assume that our students are representative students we work with in terms of social work students are representative of this survey, then that's huge, absolutely huge. And like I said, that we may not, that's self-reporting. That's not students who are reporting to universities, seeking support from universities or from disclosing them. So we've got this huge unknown around mental health in students that we need to be mindful of, I think, is what I take away from these surveys. So, I mean, the upshot of those 2 slides is that mental health challenges to well-being are a prominent issue for many students. So, as I mentioned before, this is the guidance, as I put the link in the chat. If you want to download the guidance, and it includes various case studies and backgrounds, and talks about the student mind surveys and so on. But it also includes a number of recommendations, and the guidance breaks these recommendations down into 4 areas. The first one being preparing students for placement. Second one being supporting students whilst on placement, and then a specific recommendations for health and social care placements, which they also means that social work comes under that. And the 4th area of recommendations is supporting students returning to academic study. Just drink of water. I'm not going to go into the 4th one today because I don't think that's particularly relevant to this audience. But the first 3 I'll cover in the next few slides. So in terms of preparing students for placement, number of recommendations that the University's UK guidance speaks of. One is about quality assuring placements providers in terms of their effect on mental health and wellbeing. Now, I know as well as you that the situation out there in local authority social work landscape at the moment is very challenging. I talk to social workers on a daily basis, and I talk to my friends who are social workers on a regular basis, and it's tough, isn't it? It's hard out there at the moment. We've 13, 14 years of austerity, local authorities are on their knees, retention's not in a good place at the moment, and so on. It's hard being frontline social worker at the moment. So, I suppose we're going to have to acknowledge that is part of the context that students going into placements at the moment. And I don't suppose that context is going to shift dramatically in the near future, at least. But we do, so it's also trying to get a sense of where, where placements do have an impact on mental health and well-being, and so then you can sort of start to mitigate that. And local authorities often do that. Obviously, do that for their and employers do that to a degree for their workforce. Just thinking about it in terms of students. So the second one about preparing students for placement is about normalising conversations around student employee well-being, and I think. Well, perhaps we'll talk about this in a bit. I wonder if where people feel we're at with this. I think like I said at the beginning, I think we're much better at this sort of thing than we were 20 years ago. But I suspect we've still got a long way to go in terms of enabling people to feel confident and open to talk about their well-being, and particularly in the social work student practice learning situation, where students might feel that might have a negative impact in terms of things like fitness to practice and that sort of thing. There are certain risks for students in terms of talking about their well-being. Ensuring placement settings and locations appropriate for each individual. So this is something that obviously I spend a lot of my time doing, working with local authorities, is trying to find placements that are going to meet the needs of students, obviously meet their learning needs, but also meet their personal needs, whether that's around caring responsibilities, whether they've got disability, disabilities or so on, trying to match students with placements that meet their needs. And of course, the truth of the matter is that practice learning opportunities are a limited resource in the West Midlands region, as they are across the country, and sometimes it's not always the best fit. Also, I think this is a key one about setting expectations for students about what their placement will be like. And I think this is something that we need to think a bit more about. And again, I think this is a knock on from the pandemic, whereby, for example, when pre-pandemic, we would expect students to be in the office 5 days a week. Yeah. 9 till 5, or 37 hours a week, or 35 hours a week, or whatever it was. And because students were in the office 5 days a week, and everyone else was in the office 5 days a week, there was this kind of serendipity about practice learning opportunities that came along. The water cooler moments whereby, there'd be another social worker in your team and perhaps say, oh, you know what, I've got this piece of work. It'd be really good for your students to take it on because it would make this learning outcome for them. It'd really help me out with this piece of work. And, say, yeah, that's a great idea. Go and talk to the student about it. And so those kind of, water cooler kind of serendipity kind of opportunities that possibly still don't quite happen in the same way now with hybrid working and working from home and so on. So so I think it's being really clear about what the expectations are for students, what the placement will be like, I think is very important. We also have to remember, and this is actually a really good point, that there's a changing demographic when it comes certainly to undergraduate students. When I took my first full-time academic post in 2008, if you ask me what the demographics were of my students, my BA students, my undergraduate students, I would say predominantly women, predominantly midlife career changers, people who've been working in the care sector for a while or have been homemakers, family raisers, and so on, and wanted to upskill, wanted to become a qualified post, or kids have left the home, wanted to get a career. And I'd say that was the kind of typical makeup, typical kind of demographic of the students that I was teaching 10 years ago. So that's changed now. That partly because of how social work degrees are funded and so on, is not the same now. The vast majority of my undergraduate students are women who have recently completed a BTEC Health and Social Care, and so come with a very different set of understandings of social work, and very different understandings about the world of work, for example. If you've midlife career change, your understanding about what's required in terms of the working environment, what's required in terms of professionalism, professional accountability, is likely to be very different from 19 years old, just in a college. So I think we need to be much better at setting those expectations, because I think we still sometimes expect our students to have the same expectations about placement, about what the world of work looks like, that perhaps our midlife career changes. See what I mean? And actually, our students are not these midlife career changes anymore. In a different set, different kind of world, different demographic. So that's something I think we need to get better at in terms of starting where the students are at, in terms of setting expectations about what placement's like. And then the last point on this slide is about embedding wellbeing in pre-placement briefings and induction. I'll come back to this in a bit more and talk to you a bit more about what we've done at the University of Birmingham in order to embed wellbeing in the pre-placement briefings and induction. So yeah, so further recommendations about preparing students for placement. It's about arranging individualised support and adjustments for students that need them. This is an ongoing piece of work. Now, students at universities who have a disability, for example, can apply for a reasonable adaptation plan, and the university will produce this plan, and for the most part, it's written around university assessments, so more time in exams, or extra time for different teaching resources available in different formats, that sort of thing. So although students will have these reasonable adaptation plans, they usually don't tell us very much about what that would look like in a workplace. and a practice learning opportunity, practice learning placement. So this is an ongoing piece of work for certainly us as a university, and I imagine for other universities, is to actually make that process more valid and more useful for the practice learning world. Because currently, I don't think what we do is particularly useful. I'll be honest with you now. I can't speak for other universities. I can only speak for UNB, and I don't think what we do is that useful for you and for me, to be honest. And that's the conversation I have with anyone. And when anyone up higher up the food chain has 5 minutes to listen to me, I bang on about this. So so arranging additional support and adjustment for students when needed is something that I think we need to work on, and be honest about that. So set out clear routes for contact for placement students or pastoral and employment related issues. Again, this is something that we're getting much better at. I'd say the University of Birmingham, we're definitely improving, and create peer support networks and communities for students. So those are the recommendations. So those 2 slides make up the recommendations around preparing students for placement. So the next area that the guidance talks about is supporting students whilst on placement. So several things that is key to have. One is that we've got check-ins, regular check-ins with students, that we know, we know where they are, what they're doing, and so on, and able to support them throughout the placement. Absence reporting, that if students are absent, that we've got systems in place in order to make sure that we know that, and we can follow that up. Advertise hardship funding. University of Birmingham has a hardship fund for students, and clearly, as mentioned before, the cost of living crisis is affecting our students. There's a financial burden involved with being on placement. If you want to get yourself to placement, most local authorities will pay for travel whilst you're on placement, during your home visits and that sort of thing. But obviously, there is a financial burden of being on placement, and some students, cost of living crisis is hurting. Some students are struggling. Most universities have hardship funds. University of Birmingham is no exception. As a hardship fund, students are more than entitled to access that. We need to be a little bit careful about that. I'll give you an example about how we frame that. And a student come to me last year, said they couldn't afford to travel to placement, and could they apply to the hardship fund? And we checked the hardship fund guidance, said you can't travel is not something that you can apply for. And also, the student was in receipt of the travel components of the bursary. So the student was getting X amount of money for travel from the NHS Bursary Authority. So we couldn't really go to the hardship fund and say, the student needs money for travel. But so it's all okay, if you didn't spend the money on, what would you spend that money on if you weren't spending on travel? It's like, spend it on feeding my son. It's like, okay, well, we'll apply for that then, shall we? So, and so there are ways. You have to just be a bit clever about applying to hardship funding in terms of thinking about what it is the students can and can't apply for. But there is that funding there available, and we need to remind students when they're struggling financially. And this is key, absolutely key one here. Reaffirm students' ability to access student support services whilst on placement. Now, there's a whole plethora of student support services here on the campus that students can access, and most of them they can access remotely these days, obviously, because we do pretty much everything remotely as well as IRL, don't we? So there's absolute, all kinds of support services. I'll give you one really kind of, it's not a flippant example, but it's kind of example that's moving a bit away from wellbeing, but kind of is as well. So I had a student on placement a couple of years ago, first placement, 70-day placement, and they were doing quite well on placement, but what were they struggling with? They were struggling with completing the work at the same rate as other students were completing the work. So when we myself and the practice educator, we sat down with the student, said, what's going on here? She gets my IT skills. She was a mature student, so she wasn't a kind of digital native, I suppose. And she said, look, it's my IT skills. I can't produce the written work in terms of contact recording and planning and so on to the same speed other people, because I haven't got the IT skills. So that's why there's an academic support unit in the library at the university that provide IT skills. No, I didn't know. So of course you haven't. Just because you're not on a university campus doesn't mean that you don't have access to the support services. So she went to the academic skills unit in the library here. She got some support around IT skills. Guess what? She upped her IT skills. She passed the placement. Everyone's happy. So, it's really important that we are aware that those support services exist. And there are support services around wellbeing, support services around disability, there's support services around substance misuse. There's all kinds of support services So reaffirm students' ability to access those support services whilst on placement. Just because they're not on campus, it doesn't mean they're not part of the university community and they haven't got the right to access those services. At the end of the day, they're paying for them. They're paying £9,000–10,000 a year to access those services. So it's really important to support students to remember that. Okay, how are we doing? So yeah. So on specific recommendations for health and social care placements, the guidance talks about making sure students understand fitness to practice procedures. So this is obviously this can be quite a thorny issue, isn't it? It can be quite difficult because sometimes wellbeing issues can become fitness to practice issues. Not as often as you might think, but it does happen, and that fear is going to hang over students if they are have got concerns about the well-being, I've got concerns about mental health, you might think, well, does this mean that, could this have negative implications for me in terms of my placement, my degree, my career? So that's something that needs to be really, really mindful of. And the practice supervisors and practice educators have enough time to support placement students. Now, you probably are laughing at this one because, and I know that in theory, you get workload relief. In practice, you don't, do you? So I know that, and that's no fault of you guys. I know that you want to support students. If you don't want to support students, you wouldn't be doing this practice education thing, would you? So, I know you want, of course you want to have enough time to support students. It's a stupid thing to say so, isn't it, really? But, let's be honest, the pressures are there, aren't they? And that's something that we need to be mindful of. So, so those are the three areas that there's recommendations. It talks about there's preparing students for placement, supporting students whilst on placement, and the specific recommendations around health and social care placements. So some of the potential actions that the guidance talks about are creating a self-assessment tool around placement effect on mental health and wellbeing. Obviously it talks about this, never anyone's actually done it, but it's something that guidance talks about. Embedding wellbeing literacy in placement, something that we've done in terms of preparing our students for placement. We've done a lot more recently around wellbeing literacy. Showing due regard to personal factors during placement planning, which, like I said, I hope I do a reasonably good job of, but there's a limited resource in terms of the placements that are available in order to meet the personal factors of students. Excuse me, ensuring that additional support and adjustments are in place. Now, I mentioned earlier that students have reasonable adaptation plans, RAPs as they call them here. I'm not a big fan of acronyms, but there's a lot of them at University of Birmingham. And if students have got a RAP, then they own that RAP. I can't, data protection, I can't give you their RAP and say, here's that student's RAP. It's up to the students to do that, and they should be sharing that with you as the practice educator at the earliest opportunity. So you can put you can put in place whatever they need. So ensure practice education supervisors aware how to signpost students to support services. And the placement handbook that we provide for us practice educators lists a range of campus student support services within it. If you're not, otherwise, please talk to the student's tutor as well around that if that's an issue. The other one, mentoring and peer support. That's something that we certainly developed at University of Birmingham recently, about providing mentoring opportunities and peer support opportunities for students. So next slide, I'm just going to talk about some of the things that we've done at University of Birmingham in response to this guidance, and in response to student feedback as well, actually, about how they feel about their placement experience, how they feel about how they're supported, and how their wellbeing needs are met on placement. So one thing that we've done in terms of placement preparation, we've embedded learner resilience and wellbeing into the placement preparation. So we talk quite explicitly, quite openly around wellbeing and about how to support your wellbeing. And we start off with the really basic stuff, you know what I mean? We do, like, the importance of a good night's sleep. We start with the basics. Anyone read Why We Sleep by Matthew Walker, a book I've just finished reading? If you have read it, you will never go short of a night's sleep ever again. It's terrifying. But one of the things that comes out of this is that the research shows that that people are underslept. One are not very good at learning. consolidating learning if you're underslept is compromised. And at the end of the day, students are on placement to learn. We expect them to learn. If their capacity to learn is compromised by the fact that they're not sleeping well, then that's something that's important to take into account, isn't it? Really, to do something about. And then, of course, the other thing around being underslept is the significant impact on things like emotional equilibrium. You know, that we know that people who are underslept tend to have less regulated emotions are less regulated. So, you know, we think about this really basic stuff, but, you know, some of these students are, like I said, they're 19 years old. They perhaps don't know about sleep hygiene and how to do that sort of thing. So things, you know, we start off with the basics: sleep, eat nutritious food, move with a purpose at least 3 times a week, and that might look different for different people. Socialize with people whose company you enjoy, you know, make time for that sort of thing. Really, really important stuff, really basic stuff that we all know when we think about it for a minute. But perhaps when we're deep in the trenches of practice learning, we're worried about assignments and work that we've got to do and the learning and all that perhaps gets pushed to one side. So we're foregrounding it. So that's something that we've really tried to bring into the practice learning and practice preparation experience for the students. So one of the big things that we've done, we changed recently at the University of Birmingham. It's recently, I mean, this academic year, is we changed our placement tutoring system. Previously, before my time at the University of Birmingham, they had a system of tutoring whereby tutors external to the University of Birmingham were responsible for overseeing the students' placement while they're on placement. Feedback from students is that they didn't really know who these people were. They didn't know, it didn't help with them feeling disconnected to the university and from the campus. So one of the things that we've done is we've brought the tutoring system in-house. And now the tutors who are tutoring our students are my colleagues at University of Birmingham who work here and are part of the academic system here within the university. And I think that's going to have a huge impact on a beneficial impact on our students' experience of placement. So that's something that we changed. In terms, so intervision, third bullet point on this slide, intervision is a model of peer-led group supervision, but very similar to kind of systemic group supervision. That's very popular. This intervision model is very popular in continental Europe. If you go to continental, you know, social work settings in continental Europe, they'll talk about intervision all the time. We don't really talk about it here in the UK. But it's a really good model of doing peer-led group supervision. So when we have students back in for recall days, we did a small group peer-led group supervision. And the research is really interesting on this. It's comparative research done across Europe of students' experience. And one thing that they talk about is having the opportunity for peer-led group supervision is really beneficial in terms of how they experience and how they gain and learn from the practice learning experience. So that's something that we've introduced here at the University of Birmingham. We have 100-day students that just started on placement last week. They have 5 recall days. During those recall days, they'll be doing these peer-led group supervision sessions. Anyone wants to know more about intervision, let me know. I've got a couple of journal articles and some talks about that. The other thing that we're doing is we're doing Zoom drop-in sessions. This is once a fortnight on a Wednesday evening. Myself and my colleague Sean have a Zoom drop-in session for an hour. The students just come along, so you can come along and be there. They can, if they want to come along and tell me what's going on in placement. They can, if they want to come along and ask me. Yeah, okay. So, you know, about some aspects of their portfolio they don't understand, whatever it is, or, you know, or they just want to have the rants. It's there. It's an hour every fortnight. The Angel, yes, okay, but so I'll get that to you. And so that space exists. And what's really interesting is we're not getting huge numbers of students coming to those sessions, but when I've asked the students about this, I said, you know, what do you think about these drop-ins? They like that they're there. Which I think is really interesting. They're not necessarily used. I suppose it's a bit like an insurance policy, isn't it? You're paying every month and you hope you don't have to claim on it. And I think that's kind of how the students are thinking about these drop-in sessions, that they're not necessarily attending, but they're glad that they're there. And I think that, you know, that's Oh yeah, of course, yeah. So I'll attach the 2 journal articles I'm thinking of. I'll attach them to the emails you see with the slides from today, and then so you can distribute everything to everyone. Then that's great. Okay. Yeah. Another thing that we're introducing is mentoring. So this is something that we've done with our alumni office. So we've identified a number of alumni. So they're all social work graduates who are prepared to offer a mentoring service to our students. This is available to, well, currently it's available to all our 3rd year students, all our final year students. We're hoping to expand it to 2nd and 1st years as well next year. Now, when we put together this mentoring scheme, the idea is students matched to a mentor, and that mentor can be with them not just throughout their placement, not just throughout their degree, throughout their career if they want, as part of the, developing their professional network, an additional, avenue for support outside of the student's experience, the university experience, practice learning experience. It's completely outside that. This is between them and another qualified social worker who's not, it's got no skin in the game when it comes to assessing them on placement and that sort of thing. Now, when we were recruiting these mentors, we were specifically looking at 3 areas of 3 particular demographics, I suppose, really. And that is mentors who are of colour, so black and minority ethnic mentors who have disabilities, and those who are care experienced. So those are the 3 groups that we deliberately went out to recruit for this mentoring scheme. Our mentoring scheme is available to all our finalist students. If you've got one of our finalists and you think they'll benefit from the mentoring scheme, talk to them. They're not currently accessing it, as far as you know. Talk to them about it. If you want more information about it, I'm happy to share information about how they can access that. But it's open to all, but it's particularly strongly would encourage our black students, our disabled students, and our care experienced students to access it. With minds that they'll have mentors who will have some understanding of their experience. And then the other thing that we introduced is wellbeing coaching. We've recruited someone to work whose background is as a social worker, but also as a psychiatric nurse, who is offering wellbeing coaching sessions to our students whilst they're on placement. So we're doing, I think we're doing a lot. I think we're doing well. I think we're a bit late to the game. This is all stuff that we've introduced this year. But I think it's all stuff that we can, that hopefully will have a positive impact on our students' well-being whilst they're on placement. So that's really my last kind of substantive slide. So I was really at this point, I was just going to throw it open to you really. And thanks. So I was going to throw it open to you really. I mean, just thinking about your own practice education practice. Just wondering, how can you embed or further embed well-being into what you do with students? And I suppose this kind of the next question from that is, what is it that you currently do that you think can be shared as good practice? That